Morning, everyone. Thank you for joining us for this morning's Medicare update presentation. This is the final APPRISE online program in a long season of open enrollment programs. We thank you for being a part of this and for coming to us for information and guidance on picking the best Medicare plans for you and your spouse or person that you provide care for. Our presenter today is one of our longtime, super well-trained volunteers, Donald Zaslow. I'm going to go ahead and turn this over to him.
Thank you, John. Good morning, everyone. Again, my name is Don Zaslow. I'm a APPRISE counselor. I've been doing this for about 6 years. And it's been a very busy open enrollment season, and we're coming to the end here. So if I say anything this morning that interests you or say something that you think requires you to take some action, you may have only till December 7th to take that action. And I'll mention that a few more times as we go through the presentation. So who is APPRISE? We are a volunteer nonprofit organization funded by the state of Pennsylvania, the state health insurance programs. And we do quite a bit during the year, and we do even more during open enrollment. Most of our counselors have at this point a very good understanding of what Medicare can do for you, what it can't do for you. We can provide information on Medicare Advantage plans, on prescription drug plans, on Medigap or Medicare supplement plans, and also quite a bit about programs that the state provides to help some people with their costs associated with Medicare. So quite a wide-ranging series of programs we do through the year. At this time of the year during open enrollment, which runs October 15th. Oh, next slide, please. That runs from October 15th to December 7th. One of the things we focus on is looking ahead to the next year and to see what kind of changes are coming down the road and how they might affect you. So again, 10/15 through 12/7, today's the 3rd. We have 4 more days to go. We can reevaluate your drug plan. That is something we really highly recommend you do each year for a number of reasons. Number one, the drug insurance companies change their rules, their formulary, their premiums, their costs each year. Number two, you may change the drugs you're taking each year. And there is money to be saved. And so we encourage everyone during open enrollment to review their drug plan. That's something you can do on your own at Medicare.gov, or you can have a session with an APPRISE counselor who will walk you through that. You can also, during open enrollment, review your Medicare Advantage plan. You're allowed to change that once a year at least during the open enrollment period. The goal, of course, is to make sure everything you need is covered and you're paying the least possible costs for that coverage. Next slide, please. So I mentioned that there are a couple of things that you can change during open enrollment. I mentioned Medicare Advantage plans. And some of the things that you need to consider: are you paying a monthly premium for that Medicare Advantage plan? Some Medicare Advantage plans now have a 0 premium. Now that's a separate premium for Medicare Advantage. Everybody on Medicare is going to pay the Part B premium. This year it's $144.60. It's going up a little bit next year. So monthly premiums. You want to look at the copay you're paying to your primary physician, the copay for your specialists, what kind of deductible is associated with inpatient care if you have to go in the hospital, same for outpatient emergency room, prescription drugs. And then every Medicare Advantage has their own series of benefits associated with dental, hearing, and vision. And some offer gym membership. So all of that information has to be taken into consideration when we're deciding on a Medicare Advantage plan. Again, a lot of that work can be done on Medicare.gov, or you can work with a counselor to come up with the best plan for your needs. If during this presentation you have questions, I think, John, they can use the chat to pass a question to you.
That's correct, yes.
Okay, so you have a question, just use the chat feature should be at the bottom of your screen where you can enter a question and we'll try to address those questions. Next slide, please. So the other area where we can make changes during open enrollment, I mentioned, was prescription drug plans. The key pieces there, the premium, the formulary. Not every insurance company is going to cover every drug. You want to make sure the drugs you take are covered, what you're going to pay for them, the deductibles and copays associated with them. And the last item is pretty important. A lot of the insurance companies make special deals. They have special relationships with pharmacy chains, Rite Aid, CVS, Walmart, and they provide better pricing if you use a network pharmacy. But to be clear, oh, no, go back one. Even though a insurance company has a preferred pharmacy, such as, let's say, CVS, what that means is that if you go to CVS, you would get the best pricing for that drug. But it does not mean that you cannot go to any other pharmacy you want. You may pay a little more, but sometimes convenience takes over and you just may want to go to another pharmacy. So you're not ruled out from using another pharmacy, but you may not get the best pricing at that pharmacy unless you're using a preferred network pharmacy. Next. So again, during open enrollment, I mentioned that we do the 2021 update presentation, and you're getting a taste of that now. There are also presentations on how to do a comparison yourself. And as you can see at the bottom of the screen there, we have some YouTube presentations. So the presentations we've done during the open enrollment period have been recorded, a lot of them, and they can be found. If you need any information from these slides or need information on how to get to presentations, I will give you that information a little later in the presentation. That'll come up. You could also call Glenda Radical at APPRISE, and she's always available to help if you need further information or if you want to schedule an appointment. So moving on. So Louisa can be called at 484-494-3769, or you can email her at louisa@yahoo.com, and she can provide you with copies of presentations and links to recordings if that is what you are interested in. Next. Now we're going to start talking about some of the changes coming along for 2021. Some of them more important than others, but we will cover most of them. Next, please. So the first one has to deal with end-stage renal disease. Up until now, not every Medicare Advantage plan had to take an ESRD patient. Starting in 2021, an ESRD patient can join any Medicare Advantage plan that they choose, and their ESRD costs will be covered as any other cost would be covered. So if you have ESRD and are not covered under Medicare Advantage, you should reevaluate your Medicare Advantage plan. Even if you're not an ESRD patient, you should be reevaluating your Medicare Advantage plan. In fact, I did that with someone earlier today who happens to be online with us. And Pat can attest to the fact that she's going to save quite a bit of money by changing her Medicare Advantage plan. And no questions asked during open enrollment. If you want to switch Medicare Advantage plans, you can go ahead and do so. Again, no penalties, no questions asked. Next, please. The next change has to do with something called expanded health-related extra benefits. So over the years, Medicare Advantage plans have continued to evolve by adding new benefits. The Medicare Advantage plans are really in competition with original Medicare with a Medicare supplement. So, of course, they're trying to add as many benefits as they possibly can. And for 2021, they're providing some extra benefits for Medicare Advantage plans called expanded health-related. And the key word here is health-related. So what item or service is considered health-related? Well, it's diagnosis or prevention or treatment of an illness or injury. The treatment has to be recommended by a licensed medical professional. It can be physical, it can be psychological. What's important to understand here is each Medicare Advantage plan will have its own list of extra benefits. So when looking at a plan, you need to determine what extra benefits that insurance company is providing. This is not universal. Not every company is going to provide every one of these benefits. And on the next slide, we can take a look at some of those benefits. So here's a big list of things that Medicare Advantage plans can now offer. Again, they may not offer all of them, but they can if they wish to. So acupuncture. I have another section on acupuncture, so I'm not going to go into any detail here. I'll talk more about acupuncture later in the presentation. Bathroom safety devices, so you can get in and out of a bathtub or a shower. Fitness benefits. Home safety assessments. Someone would come and look and see what can be done to your home to make it safer for someone who might be disabled. Wigs if you're undergoing chemo. Meals, nutrition therapy, over-the-counter benefits. So that's a good one. Most Medicare Advantage plans are now offering over-the-counter benefits. So these are non-prescription items. Medications, Band-Aids, almost anything. Each Medicare Advantage plan usually has a catalog that you can choose from. They usually give you a certain amount of money to spend. So that's a benefit that quite a few people can take advantage of. PERS, that's like a personal warning device you've seen on television where someone might wear a device around their neck, and if somebody has an accident or falls, they can press the button on that device and someone will respond and send help. Transportation, weight loss programs, again, when you're looking at a Medicare Advantage plan, you're going to need to inquire of that plan what types of extra benefits they are going to provide. I'm just going to stop here and ask John, are there any questions at this point, John?
There was one question. Let me bring that up. Patricia Henry asks, what is the Part B premium amount next year?
I think it's, without looking it up, I'm very close. I think it's $148.50.
Okay.
It has gone up. Now, I guess this is a good time to mention this. So there's something called a no harm provision in Social Security. You may not be aware of. It works this way. Every year, the government is going to decide whether the Part B premium is going to go up or not. This year it did. It's going to go up. I think that's $3.90 or whatever. It's going to go up to $148.50. I think that's the number. They also decide at the same time whether your Social Security benefit is going to go up. And this year it is going to go up a very little bit. Well, it turns out that the no harm law says that from one year to the next, your Social Security payment from the government cannot go down. So if it turns out that the increase in the Part B premium is greater than the increase in the Social Security benefit, you will not pay the full premium because by law, your Social Security payment cannot go down one year to the next. A little hard to follow. I hope everybody got that. But you should, any day now, we should be getting statements from Social Security, you know, listing all the new pricing, your payment for next year, what they're going to take out of your Social Security check, and so on and so forth. Anything else, John?
That was all. Let's see. That's it.
Okay. Next, please. Okay. Again, we're talking about changes for 2021. Special benefits for the chronically ill. Next, please. Now, again, that first statement is very important. Medicare Advantage plans may offer additional benefits. They're not required to. They may. Again, you need to inquire of the company. They're not primarily health-related benefits. So we need to define some things. As you can see, offered on a case-by-case basis. In fact, these insurance companies will work with you to customize a set of benefits that may be advantageous to you and the issues that you are dealing with. Next, please. So they can reduce the amount of money you're paying for a particular service. We need to define, though, the difference between chronically ill and just extra benefits. So again, chronically ill is going to fall under a certain definition that the insurance company is going to use. A licensed physician will have to approve this. And we have some examples on the next slide. So here are some examples of special benefits for the chronically ill. We can have home delivered meals. One of the new things this year is fresh produce. If you qualify, fresh produce can be delivered to the home. Transportation for non-medical needs, as opposed to transportation, say, to a hospital or to a doctor's appointment. Pest control, air quality, modifications to your home, help with paying bills. Again, every company is going to have a different set of benefits. And if you fall into this category of being chronically ill, you'll need to speak with them individually to determine what they may have that you can take advantage of. Next slide, please. Medicare step therapy. Those of you on a drug plan may have become familiar with this. What is step therapy? Well, step therapy says that for certain conditions, the insurance company is going to insist that you start with a certain drug, of course, a less expensive drug. If that works, then fine, we're done. But if it doesn't, then we can step up to the next drug, and there may be 2 or 3 drugs that you can try. If they don't work, you eventually get to probably the drug that will work. That's called step therapy, and it's been used as part of the prescription drug plans for a while. In 2021, they're going to use that same philosophy with Part B drugs. There are a number of drugs, vaccines that are provided under Part B and are free under Part B. And they are going to use the step therapy. Of course, the purpose is try to reduce costs. A lot of the things that are being done by the insurance companies are to reduce costs, and step therapy is one of those. Next. Opioid treatment. There's been a big push to include opioid treatment now as part of Medicare. So you can see opioid use disorder treatment services, they call it, covered under Part B. And of course, that's why in concert, they're including step therapy for Part B now, I'm sure, to deal with a lot of the opioid issues. No cost for these services beyond the copays you would normally pay. So, as you know, if you go and see a doctor under Part B, it covers about 80% of the cost. If you're on original Medicare, many of you may have a supplement that pays the other 20. Or if you have Medicare Advantage, you have a copay associated with that visit. Well, when it comes to opioid treatment, those same copays will apply, roughly 20% of the cost. Next, please. So methadone now covered for opioid treatment. As you can see, there's some of the services that are provided. Medication, counseling, drug testing, therapy. All of those services can now be made available for a Medicare Advantage or Medicare program. Next. So again, the new program establishes coverage of methadone for the first time. They have had coverage for buprenorphine. I'm not really familiar with that treatment, but the methadone treatment is now on top of what was already covered in previous years. A lot of things have changed during the pandemic, and this is just emphasizing the fact that a lot of the contact between physician and patient can now be done by telephone. And we'll see a little later, we're going to talk about telehealth. I've, during this 9 or 10 month period, have used telehealth a number of times, and I find it really useful. And when it's applicable, I'd rather do that than go to the doctor's office. So even in the future, when this pandemic ends, I think that's something that we'll see more and more of. Next, we're going to talk about telehealth. I'm just curious of how many of you, I can see some of you, have any of you used telehealth service during this pandemic? Yeah, I see a couple. Okay. And are you happy with it? Thumbs up,
Yes.
thumbs down? Uh-huh. So back in March, they started, and it's during the duration of the COVID-19 public health emergency, which is still ongoing. You can visit your clinician from home. That's the bottom line. And again, you should check with your particular insurance company to make sure they're covering the kind of service that you need. Medicare will pay for office, hospital, other visits furnished across the country. You need to consent to it. So the process usually works like this. You're talking to a doctor's office on the phone. You say you want to make an appointment, and you say, geez, I'd really like to do it from home. And they say, fine, they get some information. They'll send you the information online. They'll provide you with a link. They'll ask for your consent. And at the time of the visit, you click on the link, just like you clicked on this Zoom presentation. And lo and behold, there's the doctor staring at you, and you have a conversation, and on it goes. So it works pretty well if you haven't used it already. Next. So Medicare will pay for visits. Again, you need to look. Each insurance company may offer a slightly different group of benefits. You want to make sure what you need is covered by the insurance company. Next, please. Covered most of this. So again, the coinsurance, the deductibles that you would typically pay, they're still relevant here, even though it's not in the office. Those deductibles and copays still apply to the telehealth services. And you don't have to live in a rural area to qualify. It doesn't no matter really where you live. Each health system or doctor may use a slightly different technology to allow this to happen. But typically, as I mentioned, the doctor's office will provide you with the information that you need and the software you need to take advantage of. And again, the patient must verbally consent to receive the virtual visit. Next, I mentioned that I would talk in more detail about acupuncture. So for the first time in 2021, Medicare Part B is going to cover acupuncture visits. Very specific though. So it covers up to 12 visits over a 3-month period for chronic low back pain. That's it. Chronic low back pain. That has to be the issue. And it's back pain that lasts 12 weeks or longer, no identifiable systemic cause, not associated with a surgery or a pregnancy. And if during your visits there's improvement, they can provide an additional 8 sessions beyond the original 12. Only 20, the limit is 20 for the year. If the back pain during those 12 visits isn't improving or it's getting worse, the treatments will not be covered any longer. So that is acupuncture, and it's new. To me, this probably is the most important change because it probably will end up covering the most people. Part D insulin costs can be very expensive for diabetics. And a significant change has been made to the prescription drug plans for 2021 to deal with insulin costs. Next. It's called the senior savings model. So we're trying to lower the out-of-pocket costs for insulin. I keep saying this for many of the benefits. Again, the insurance company is not required to provide this benefit. You need to ask whether they are offering this benefit. So by law, I believe they have to offer, if they're going to offer the benefit, they have to offer at least one type of insulin. By law, they don't have to offer more than one. Many will offer more than one. So a great importance on communicating with your insurance company to determine whether your needs will be met. And the benefit will cap the insulin costs at $35 copay for a 30-day supply. And many people now on insulin therapy are paying a lot more than $35 a month. But under this new benefit, that is the cap. And if we go to the next slide. So beneficiaries should save an average of $446 in annual out-of-pocket costs. That's their estimate at this point. Once we have a year under our belt at the end of 2021, we'll be able to understand how much it really saved people. And that address at the bottom of the page, if you're interested in reading more about this new program, you can use that website to do so. Next, please. So the current plan, as you can see, the costs, depending on the deductible for the plan, your initial coverage, your coverage gap, it varies all over the place. Whereas the new model on the right side, as you can see, is again capped at $35 a month. So this is something that I think is going to be of great use to a lot of people. I counsel a lot of people, and those who have diabetes are always complaining about their insulin costs. They can be quite significant. Okay, next. I don't know how many of you have utilized Medicare.gov, the website. It's a great website. You can get information about prescription drug plans, about Medicare Advantage plans. This happens to be a screenshot from Medicare.gov. And it's a screenshot of someone looking for a prescription drug plan. And as you can see, on the right side, halfway down where it says insulin savings, if you click on that, it should provide you with those insurance companies that are going to provide the senior savings model for insulin. Okay. Another couple of changes have to deal with something called extra help. So there are programs that can assist individuals with their drug costs. Plans are usually based on your income and assets. And you need to apply for extra help. You can apply on the Social Security website, on the Medicare website. You can work with a counselor to apply. And this chart just shows the difference from 20 to 21. Very little difference. But what they're doing, the extra help plan, is helping with brand name drugs and generic drugs, basically. And as you can see, for generic drugs, $360 in 2020, $370 in 2021. So what they're saying is that's the most you're going to pay for any generic drug. So a considerable cost saving, and the same with brand name drugs. So each generic and brand are going up a little bit in 2021. But if you do qualify for extra help, it's quite a bit of savings over the cost of drugs that you would normally pay. What I tell people when I counsel them is, well, first we go over I'm not going to throw out numbers today. They're easily available online, or you can talk to a counselor. But when we look at income and asset numbers, even if you're close, we recommend that you put an application in, because they factor lots of things into their determination, and it doesn't hurt to try. The worst thing that can happen is they'll turn you down. So they're the little changes being made to extra help in 2021. Next, please. There's also help with the Part B premium. And again, there's about 4 different levels, depending again on income and assets. But you can save quite a bit of money. Some people pay nothing for their Part B premium, say some pay a partial premium. This chart, though, is only to show the small changes that are taking place from 2020 to 2021. If you think you qualify for either assistance with Part B or assistance with Part D, I really recommend you make an appointment with a counselor so you can review your options. Okay, I think, John, this is a good place to stop and see if there are any more questions at this point.
I have nothing in the chat right now.
Okay.
If anybody has a question that they want to ask out loud, you can unmute yourself and ask Don, or raise your hand.
So I mentioned Medicare.gov. There is an enormous amount of information available. And I would urge anyone who has a computer or a phone to take a look. I like to say that almost anything you'd ever want to know about Medicare is on that website. The problem is finding it, but it's probably there. And the same goes for the Medicare and You booklet. Most of you should have gotten a 2021 Medicare and You booklet. If you haven't gotten a booklet, you can go online at Medicare.gov now and look at an online version or order a paper copy. I always keep that around for reference. The other way I get information myself about Medicare is if I have a question that comes to mind, I Google that question. I've never not had a response that makes sense. It's just amazing what you can Google. So any question that comes to mind, is this covered? Will that work? It did. Whatever it is, you Google that, you'll get lots of information to read. May not be everything you need, but it really will be helpful. So I strongly encourage people to use their computer, at least as a primary resource, even before they may talk to a counselor. Next, please. Okay, so last year, for the first time, Medicare decided they would like to provide the ability for an individual to set up an account. And to set up an account, you need to create a username and password. You can do that yourself on Medicare.gov. We will show you how to do that. Or a counselor can help you do that. What's the purpose of a username and password? Well, once you set that username and password up, all of your Medicare information will be stored going forward. So, for instance, some people take 1 or 2 drugs. Well, year to year, it's not hard to put 1 or 2 drugs in, but I've seen people that take 10 or 15 drugs, and you certainly don't want to have to enter them each year. If you have an account, all that drug information, the prescriptions you got during the year will be saved for you. So if I go in the next year, I can modify that list, or I can say, oh, I want everything on that list. It makes things a lot easier. You can also look at the plans you have. You can look at your history. So there is a lot of information available to you if you have an account. Now, that's the plus. The downside is people get accounts and then they forget their username and passwords. And sometimes it can be a little difficult to recover that. We've learned some tricks this year to do that. So, but I'm encouraging folks, once a username and password is set up, if you set it up for yourself or a counselor sets it up for you, please put it somewhere where you'll remember you put it and you'll be able to reuse it. So that is the usernames and passwords. Next, please. So if you have trouble logging in, you call that number and they're going to refer you to someone like us to help you. So again, open enrollment 10/15 to 12/7. Bottom line there, this open enrollment period does not apply to Medigap / Medicare supplement. Hope everybody ever understands Medigap, Medicare supplement, same thing, just 2 different terms for the same thing. You can apply for a Medigap policy anytime during the year. That can be an initial policy for the first time or to replace an existing policy. That can be done anytime during the year. Now, there are some issues that I'm going to cover in a moment. I said you can apply. It doesn't necessarily mean you can get it. There's a difference. So let's move on. So, for an individual who is just turning 65 or is coming off an employer's insurance program, the federal government guarantees you the right to buy that Medigap policy, no matter what your health conditions are. That is, no matter what your pre-existing conditions are. And they guarantee that for 6 months from the time you sign up for Part B. So you just turned 65, or you could be 80 years old and you've been working. And you sign up for Part B, you then have 6 months to sign up for a Medigap policy. without any concern for health issues. But once you go beyond the 65 years and 6 months or the end of employment, there is no guarantee. So again, you have the right to apply. So let's say I don't have a policy. I'm 70 years old now and I would like to get one because my Medicare Advantage costs are going up. So I want to move over to original Medicare with a supplement. I can apply. What will happen at that point? The insurance company will see you're beyond 65 years, 6 months, and they will underwrite you. Underwriting is the following. They will give you a medical questionnaire. Depending on the answers that you give to the medical questions, the insurance company has the right to do one of three things. They can sell you the policy, they can turn you down, or they can sell you the policy and charge you more. But there is no guarantee. They do not have to give you that policy. Very important. So when you turn 65 or when coming off an employer's plan, it's really a critical decision as to whether you want to go with a Medigap policy or not at that point, because you may never be able to get it again. That may not apply to anybody online here, but I always say that because it's very important. Next slide, please. Lots of other rules associated. Insurance company, once they sign you up, they have to cover all the pre-existing health conditions. They can't charge you more for past or present. I often get the question though, will my rates go up? Yes, that's a guarantee, let me tell you. That I can guarantee. Your rates will go up every year. I think I've had one now for about 15 years, and I think they've gone up every year. Not a whole lot, but they go up. Next, please. Again, I emphasize the point that Medigap plans can be changed year-round. And there's the but that we've been talking about. Now that pretty much covers my formal presentation. Are any more questions out there, John?
Let's see. Nothing in the chat, Don.
Okay, you may want to go to the next slide where there's some contact information. That is Glenda Radical. Glenda runs the program in Delaware County. She's terrific, very helpful. You have an issue, call her, email her. Easy to work with. She'll provide you with whatever you need. Now, just looking ahead, I'll make a comment or two. So open enrollment is going to be over now, and we kind of take a break for a couple of weeks. But then starting the first of the year, we do from January through September of 2021, we'll be doing individual counseling sessions for individuals. If you call Glenda or other organizations, we work a lot through libraries and other facilities, and set up a counseling appointment. We do everything by phone now, of course. And during that period, January to September, we'll also have presentations that deal with Medicare supplements, with Part D drug plans, with Medicare 101, which is a complete overview of Medicare. Again, you contact either Glenda or Louisa, and you be able to get more information about counseling sessions and these presentations if you are interested. So if there are no more questions, I will just thank you for your participation and hope it has been useful. I'll try one more time. John, any questions?
Let me check. Start my video up. Nothing in the chat. Does anybody else have anything? I can stop
Raise
the
your
share.
hand if you have anything.
So we can all see each other now. If anybody has any
Oh,
questions.
God, that's terrible. All right. Well, then again, thank you all. And maybe I will be talking to you in the future.
Okay.
Bye,
I
Don.
will email. Thank you,
that?
Don. Happy holidays.
You too.
I will email a copy of the presentation out to everybody who's
Oh, okay, great.
in the room so that you'll have that. And as I mentioned in the chat, Tuesday, the 8th at 2 o'clock, we have a program on fitness fun with folks from the Penn State Extension. Let me know by email if you want the link for that. We'll also have it up on Facebook Live.
Bye-bye, everyone.
Take care, everybody.
Thank you.
Okay.
Bye.